Guys, it's Mary from Portland Doulas. I wanted to take a minute and speak with you about pelvic positioning. We're going to do a quick exercise which will really form the foundation, hopefully, of your pelvic anatomical knowledge for the future modules that you go through with your doula. When you sign up for services with us, no matter what package you choose, you'll be having separate prenatal visits, and those visits, when done virtually, will come with a prenatal education module so that we are able to give you visuals and walk you through different labor positioning techniques. So right now, go ahead and grab a chair. You should be able to have your feet be flat on the floor. And we are going to do an exercise to really open up your mind and make you aware of what is happening in your pelvis when you're sitting. So if you're sitting on your sit bones, you should probably not have your back on the chair. See that? So I'm sitting up in a neutral spine on my sit bones, okay? And if this were a pelvis, your sit bones would be these little knobs here that you feel when you shimmy back and forth. So go ahead and drop your knees open and feel what happens to those sit bones that you're sitting on. You should feel some type of rotation. Partners, you can do this exercise as well. It works for every pelvis, not just the female one. So if you drop your knees wide like this, you should feel that these sit bones that you're on kind of come out like this. They rotate out. So if this is the bottom of your pelvis that we're sitting on, okay, and we're pulling that out by widening our knees, look what happens to the top. See how it closes off? When you're pregnant and trying to have a baby, the baby needs to fit in here. How is that going to happen if we're closing it off? It can happen, but it takes way longer, in my opinion. So, this is really like the foundation for spinning babies techniques too, just so you know, because you'll learn a little bit more about basic spinning babies techniques as you move on with us. But if you come back to neutral here and you reset, and remember your back is not touching the chair, okay? So reset, and this time, okay, instead of going out like this and rotating out, I want you to try to rotate in so that you have some internal rotation of the hips here. Okay, so in this, when we're rotating inward, what's happening? You should feel your sit bones down here kind of squish together like that. They rotate together like this. And so when we sit like this with our knees together or our hips internally rotated, what we're doing, we're opening up the bowl, this pelvic bowl here. Okay, so as you move through your different prenatal education modules, keep that in mind. Realize that you can manipulate what can flow into your pelvis from up here, and also what you can keep out. Okay, so when I first learned that, it was really mind-blowing. I was like, wait a second, are you kidding me? I could make this go quicker? What? So remember, you can manipulate this pelvic positioning even without being in a chair. I like to demo it in a chair first. If you are in labor and pushing or trying to get baby to engage more and drop down into the pelvis, you could lay on your side with a peanut ball here. Now, most people would say, but Mary, your legs are out like this. here's the trick. With the peanut ball, I'd want you to then put a pillow underneath it right here. So you have peanut ball here with a pillow and dip that hip. If you dip this hip, all you're doing is recreating knees together. But you also have a ball here to help really stabilize this portion of your body. For moms who end up having epidurals, or we can't get baby to engage the way we want, use a peanut ball on your side. Cycle through at maybe 3 or 4 contractions on each side. So do 3 to 4 contractions on one side and then flip and do it the other side. It'll definitely decrease the amount of time you're in labor. People are usually extremely surprised with how effective it is. It's a spinning babies technique, again, that a lot of nurses know about, but some don't. So again, that's just one example of a way you can really manipulate pelvic positioning in an active labor position instead of sitting in a chair. You can't sit in a chair when you're in labor. No one sits in chairs. I'm kidding. Some people do. If you guys have questions, you can email us at portlanddoulacollaborative@gmail.com. I know that you all know how to get in touch with me. You can also reach out to Jess, who is a labor doula in our office, and she's more than qualified to help you with these techniques as well. Hang in there, and we will get you going with your next video shortly.